In this video, we're going to discuss which techniques men choose and which techniques they might wish to choose if they knew a little bit more about them. If you've been to the channel before, it's great to see you again. If you haven't, then it's great to see you. By all means, like, subscribe, leave any comments that you might have, as it helps promote what we do and gives me reason to make more videos that people hopefully find interesting. Today, the topic is going to be on male plastic surgery. The reason why I bring this up is because in my practice, probably over the last 5 years, it's gone from representing maybe 5% of my total surgical practice to now representing 15, 16, maybe even 17%. I think both men and women are coming around to the notion that self-betterment, including the gym and hair and clothes and general aesthetic look, can include non-surgical or surgical techniques. And in this video, we're going to discuss which techniques men choose and which techniques they might wish to choose if they knew a little bit more about them. So hopefully watch to the end and you'll see some interesting thoughts on how we can improve the male appearance with plastic surgery. The interesting thing when it comes to male plastic surgery is that men don't quite want to look as perfect as the ladies do. The improvements they're hoping for tend to be more modest. They often say, I look craggy, I look tired, I look heavy-faced, and I would like to improve this, but they very rarely ask for perfection. They don't want to look 25 again. In fact, often they don't have a very specific goal that they want to look like. They just want to look fresher. And so this makes our job in cosmetic surgery a little bit easier, because to look fresher is a lot more simple than to look perfect, as you can imagine. And there's a number of techniques which we can apply to make men look fresher. One procedure that I perform very commonly in men is a lower lid blepharoplasty with Midface lift. I have a video on the technique elsewhere on the channel, but in summary, it addresses eye bags, it also addresses the tear trough, and it addresses the fallen cheek, which in turn weighs heavily on the corners of the mouth, creating nasolabial lines and marionette lines. And in the very late stages, it creates jowls, which are the face falling across the jaw. This is a problem for men and women equally, but it seems to be a problem that men are happy to engage with and discuss surgically. There aren't many non-surgical treatments which are effective, and typically when a man comes to see me with this procedure in mind, they are further down the aging road and their changes are more spectacular. This is a good operation in men. They have thick skin, which helps hide the signs of surgery in the early phases. They tend to have heavy skin and heavy faces, however, which can cause some delay in healing, because the main problem from this surgery is a little bit of pull on the lower eyelid. Nonetheless, this is an excellent operation for men. It has reliable results, which typically need about 4 weeks to recover to looking mostly normal, and 6 to 8 weeks to having forgotten that you had surgery. And so it's a great option for men. What goes along with lower lid blepharoplasty is also an upper lid blepharoplasty. Now again, for men, this is a slightly different problem, because men's eyebrows tend to sit lower on the face when they're young. And if you look at this CT scan, you will see how the bony skeleton changes, and specifically how the size of the orbit changes. That's the bony rim in which the eye sits. Now, as the eye socket or orbit increases in size, so the structures above it tend to fall into that hole. Now in men, where the eyebrow is low already, that tends to mean the eyebrow starts to fall into the hole, creating very heavy brows, and in turn creating very heavy eyelids. So for men, they often turn up with quite a profound problem, often a combination of heavy brow and heavy eyelids, and the discussion can be about treating the eyelids in isolation, giving a significant improvement but not necessarily the entire picture, or treating the eyebrow in isolation, which tends to be a more involved procedure. Brow lift, for your information, is an excellent operation, but there are many different ways to do it, which typically means none of them suit everybody, and as such it's a slightly more involved operation, slightly more surgical, slightly more recovery with a relatively modest improvement. So the conversation I often have is, let's improve your upper eyelids. There will be a significant change for the better, and if that's suboptimal, or if it's very obvious that the eyebrows are part of the problem, then we can discuss how we can combine the two procedures. But again, in men, this creates a look of brightness, of freshness, of being more awake, less tired. The scars are well hidden in the upper eyelid for the eyelid surgery. One thing to bear in mind when it comes to male plastic surgery is how much hair do they have. A number of our surgeries, including facelifts, brow lifts, have incisions within the hair, and if the man is bald or balding, or if the man is younger but has balding genes in their family, then this is something you should definitely discuss, because if the scars become uncovered, it makes a well-hidden operation much less well hidden. Nonetheless, eyelid surgery is an excellent procedure for men who have heavy upper eyelids or baggy, sad, tired mid-face and lower eyelids, and I can highly recommend it. The next operation which I perform commonly on men is a facelift. Men are not looking for Hollywood red carpet facelifts. They're looking for less sagginess in the neck, less heavy skin. They're looking for less sadness and tiredness in the cheeks and around the mouth. And as a result, facelift is an excellent operation for men. Some of the same cautions apply for facelift surgery, namely the skin tends to be heavier, the features tend to be heavier. A heavy neck in a man can be extremely heavy, very fatty with very heavy skin, very heavy muscle, and as such the technique used tends to be more industrial. It tends to be more powerful techniques that we use in men to lift a face. Another thing to be aware of is we can't move the sideburn skin in the same way that we can with ladies. In ladies, we place the incision almost inside the ear at one point, which hides it to some degree, whereas in men, if we were to do this, we would take the sideburn or the beard hair inside the ear, which would be a complete giveaway. We place this incision in a slightly different place. We also have to be aware that if the man wears short hair, then the scalp incision will also be a little bit visible, and the behind the ear incision may also be a little bit visible. It's not an ideal operation for completely bald men, although having said that, the scars do eventually fade very well, but they never become invisible in this group. In terms of the neck, then moderately heavy necks respond well to standard facelift techniques, but extremely heavy necks like these ones need an additional technique, an additional step, and this usually involves excising the skin, because a standard facelift or a standard neck lift won't remove this much skin. The best way to remove the skin in men is to do a linear incision under the chin, which we close using a Z-plasty technique, which you can see here. The technique allows a much more profound tightening of the skin, but in ladies it creates a scar that they wouldn't typically tolerate. Men, because they have slightly thicker skin and they can wear a beard, tend to not mind this scar as much, and actually it's quite a popular adjunct to a standard facelift in my practice. So overall, face and neck lift, excellent procedures in men who want to look less tired and fresher, and certainly younger, but not have a desire to look absolutely perfect like the ladies sometimes do. Botox is a great technique for men because, again, with their thick, oily skin, they tend to not have very fine wrinkles. They have broader, heavier wrinkles, and they typically want to soften these wrinkles. They don't want them to go away completely. They just want to be less deep set when they frown, smile, talk, and animate. And again, a relatively modest dose of Botox can do brilliant work for men, especially in the crow's feet and the forehead area. In my practice, I tend to leave the scowl a little bit underdone because it's good to have some movement. It takes away people's attention that you might have had Botox, and this is the desire for many of the male patients we treat. They don't want anyone to know that they've had any interventions like Botox. But overall, it's a great way to men look less tired, less rugged, and it's a relatively low cost, low effort intervention. Maybe once every 6 months would be fine. Many men seem to be put off by what they perceive as a frozen face type look, which we can create, but for most men over 40, this is not what they want. And in fact, the fashion these days is for less of that type of surgical treatment look and much more natural, which is good to see. Another treatment which we find very popular more commonly in younger men, but up to 40s, is buccal fat surgery. Now, I don't quite know why, but this seems to have been very much to the fore in social media and the public eye, because I've had more requests for buccal fat removal surgery in the last 12 months than I've had in 5 years before that. The goal of buccal fat surgery is to slim down the mid cheek. I have a video on the technique elsewhere on my channel if you'd like to learn more about it, but the technique involves removing that fat through a small incision inside the gum towards the back teeth. It's an excellent procedure with a very low complication profile, but the one thing I think you should know is that it makes a modest difference at best. It's not a profound change. A lot of people see some Instagram version of what this operation looks like, which has been doctored, photoshopped, shaded, slimmed down in some way, and the changes look really profound, and that's not really how it works. It certainly makes a difference to the width of the cheek area, and from a surgical or even non-surgical point of view, there's very little else you can do to affect the anatomy in this area other than putting in some cheek filler, which is not really the same thing, or doing some orthognathic surgery, taking a chisel, hammer and screws to somebody's bony skeleton, which again is not something that most people would consider. So buccal fat surgery, very popular, low cost, low risk, low intervention type operation with a modest result, which gives you a better defined mid-cheek area. Fat transfer and lip lift surgery, I'm going to put these two together because they tend to be less popular amongst men. Fat transfer is a good treatment for people who are very fit and athletic and have lost a lot of the softness to their face, and a modest amount of fat transfer over the cheekbones, or alternatively to augment a weak chin, can be a good operation. The fat has added value if we take it from under the chin, because it can add a modest improvement to neck definition, as well as an augmentation of the cheeks or an augmentation of the chin. Again, it's a low risk outpatient procedure under local anesthetic, doesn't require an awful lot of time off work, and has predictable results, if not profound results. And so it's something that some men would consider because there's no real signs of surgery after it's finished, which is what many men would like. Lip lift surgery, less common again, but there are some men with very thin lips who also have a long philtrum, who would like to alter both of those things, maybe a little bit more tooth show. The scar is well hidden, and it does pretty much what most people would ask it to. The difficulty is men, while they're recovering, tend not to want to wear makeup under their nose, and the scar can be a little bit visible until it heals completely, which can be 6-8 weeks in some cases. So a reasonably good procedure, but the scars are a little bit more on show than many men would choose. Finally, amongst men, we have the standard body contouring techniques: abdominoplasty, thigh lift, arm lift. Again, those patients who've lost a very significant amount of weight find that they cannot shed the skin once the fat has gone, and the surgery for men is, broadly speaking, exactly the same as it is for women. The incisions are the same, the techniques are the same, but if you're a man who hadn't considered that removing the skin was an option, then it certainly is. But it's a technique I think I probably perform, broadly speaking, 50-50 male to female, because those patients who've lost a significant amount of weight understand what surgery might be required irrespective of their sex. So that's a brief summary of male plastic surgery options which are becoming more popular. If you have any questions or are interested in learning more about any of these techniques, then by all means get in touch with us here at Adam Goodwin Surgery. If you want to learn more about the individual techniques, then please have a look at my other videos on my YouTube channel, where you can learn about each one of of them, including the process, recovery and complications. And if you just want to leave us a like or a comment, then please do. We read every single comment and I try and reply to every single one. Other than that, look forward to seeing you in the next video.